Tachycardia. When the heart rate normally is it becomes fast. So what are those arrhythmias? Sinus tachycardia, SVT, supraventricular tachycardia, ventricular tachycardia, ventricular tachycardia. Atrial fibrillation will finish. Ventricular fibrillation will finish this morning. We give a DC shock. People who have heart attack. So we are left with only now deep tachycardia. If I can finish it in 10 minutes, we can start our function at 10:30. In bradycardia, it is sinus bradycardia, was really high loss, really high loss, really high loss, LVDP. I will discuss sometime back, but we will first finish tachycardia. Now, if it is tachycardia, it means more than 100 population. It could be sinus tachycardia or supraventricular tachycardia. No, if the field seems separate in T, then it is sinus tachycardia. If he is not seen, just like in atrial fibrillation, this is supraventricular tachycardia. Number two, if the QRS is wide, more than half big square, is 2.5 small square, called ventricular tachycardia. Ventricular tachycardia. That means, so, let us start with here, tachycardia. What is the pulse rate? 300 divided by number of big squares in between the two soldiers. 300 divided, how many big squares in between these two soldiers? 1 and 2. 2. 300 by 2 is 150. 150 is tachycardia. More than 100 is tachycardia. So these soldiers are standing very, very close. They have tachycardia. Now I want to know, is it sinus tachycardia? So I start looking for the P wave. P wave is present, no normal is sinus tachycardia. So I start with RSTP, 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 RSTP. P is present and separate in P. This T, this P, this T, this P, this T. No confusion. This is sinus tachycardia. 150 maybe, so what? Sinus tachycardia has got number of causes. I mean, for example, emotion. Emotion. In Delhi hospital for 30 years I used to take the night classes, whole night. And the benches, they were not like this. The benches, no fans, nothing. And so people, 300 people had to squeeze. And out of 300, 160 girls, 140 boys. So you can see boys and girls squeezing. And OPK taking the ECG class, so everybody take. But in the clinic, as I told you earlier, patient lost weight, tachycardia, and hydroxychloroquine, 100%. Finish. This is tachycardia. You can see PNP, sinus tachycardia. And here is a tachycardia is normal, there is no bypass tract, etc. There is nothing abnormal in the anatomy. But suppose there is a tachycardia. See, less than 3 will be tachycardia because this is again 2. Little more than 2. Little less than 150, 140 is tachycardia. So the soldiers are standing very close. Tachycardia. This could it be sinus or supraventricular tachycardia? Well, you start looking for P wave. R, S, T, R, S, T, huh? Where is T and where is P? Is this T? Is this P? Is this P? Is this T? P must have 2 limbs, P must have 2 limbs. I cannot see 2 limbs or anything. That means P and T cannot be seen separately. This is supraventricular tachycardia. Why? Why not ventricular tachycardia? Ventricular tachycardia? You are joking. Because look at the QRS complex. What is QRS complex? This is Amitabh Bachchan suppose is standing. When you stand, suppose that. Got it. What is QRS complex? This is QRS complex. This is QRS. It is not an apex, one limb, second limb. Apex is upward there. So this is called QRS complex. So when I used to teach there in the medical college, I would tell them that you count, you count it, talk and start counting. 1, 1.5, 2. You can't make up their mind. It is 1.5 or 2. Up to 2, up to 2.5 is normal. 1, 2. You're wasting your time. I mean, if I say what is the distance between these two, you don't bring a tape measure and start measuring. Put your hand like that and say this much. What is the distance between my legs? This much. Finish. So then I would used to